Hi everyone, my name is Samara Gallagher, and I'm going to be telling you a little bit about my research proposal that I came up with. So, when looking at the literature, I noticed that there are a number of different treatments currently being used to treat borderline personality disorders. These include dialectical behavior therapy, cognitive behavioral therapy, and psychotherapy. I also noticed that a newer form of therapy has been introduced in order to treat this particular disorder, and this is art therapy. Art therapy has been effective in treating a number of disorders and conditions, such as post-traumatic stress disorder. It's been used to reduce bullying victimization among adolescents, provided emotional relaxation and psychological stability in cancer patients. It's been used to help individuals with dementia, as well as those suffering from anorexia nervosa. Art therapy has led to a number of benefits, including greater self-expression, revisiting traumatic incidents in a healthy manner, engaging in better self-care practices, improvements in self-concept and self-esteem, reduction in depression and anxiety. It's also led to improved creativity, creative empowerment, maintenance of self-fulfillment, dedication to art, enabling people to forget the suffering and pain they are dealing with, as well as improving activity and hand-eye coordination. There is a limited amount of research, however, discussing art therapy being used to treat borderline personality disorder and the benefits that it offers these individuals. So for the purpose of this study, I will be exploring this further, and we'll answer questions, hopefully through the research, such as what are the differences between outcomes for art therapy in comparison to multidisciplinary treatment, as well as is art therapy just as effective as other forms of treatment used to treat borderline personality disorder. My hypothesis is that art therapy will be just as effective as other forms of treatment currently being used to treat borderline personality disorder, even when this treatment is used alone. The null hypothesis is art therapy can be used as part of multidisciplinary treatment, but when used alone, this treatment does not offer the same therapeutic benefits as other treatments being used to treat borderline personality disorder. The study will use pretest post-test design, which involves observing participants, then administering treatment, then observing participants again afterwards, following treatment to see differences in scores. Participants will be selected from a group of individuals who are already enrolled in an outpatient program for borderline personality disorder at the Center for Integrated Behavioral Health in Pennsylvania. Prior to implementing treatment, participants will be asked to complete a brief questionnaire in order to screen for the study and make sure they meet the criteria that's been outlined before the study begins. They will be between the ages of 18 and 50 years old, and all participants will be assigned to one of two groups, whether that is the art therapy group, where they will only receive art therapy as their treatment, as well as the multidisciplinary treatment group, who will receive a combination of art therapy, dialectical behavior therapy, and mentalization-focused treatment. They will be asked to complete a questionnaire, the BSL-23, or the Borderline Symptoms List, which contains 23 items discussing the diagnostic criteria of this particular disorder, as well as the severity of the disorder and symptoms that exist. Participants will answer and complete this questionnaire before treatment begins and then immediately following their last session. And then the results will be compared to determine differences in treatment outcomes and the effectiveness of art therapy when compared to the multidisciplinary treatment. The paired sample t-test will then be used to compare scores and the means of each of these groups, with each subject being measured twice. Pre- and post-test scores will be compared to determine if any statistical differences exist. And based on those, we'll find out if art therapy is in fact just as effective as other forms of treatment when used alone versus as part of a multidisciplinary treatment program. Well, thank you for listening to my proposal, and I hope you're somewhat interested in this topic. I'm looking forward to hearing about all of your proposals, and yeah, thank you for listening.